All right, so welcome everybody. Thanks for joining our Central Maryland Veterans Collaborative. Today we have Stan Seidel and along with some of his committee members that are working on combating substance misuse when it comes to our military veterans and their families. So I'm going to pull up their slide deck and kick it over to you guys to start the presentation. So give me just a moment.
Thank you. I'll start off with, please note the disclaimer. I'm Stan Seidel, but I'm talking as a veteran or a veterans advocate. We are not authorized to talk for the Maryland Department of Veterans Affairs or for the Maryland Veterans Commission. However, I think the subject, combating substance misuse impacting Maryland veterans, service veterans, is extremely important. So we're going to talk to you about what we have done as a work group. So if you go to the next slide, I'd appreciate it. These are the members of our work group. Myself, Dr. Macri, Rick Lane, Penny Collins, Cynthia's on the line. We had a representative from Stephen A. Cohen Military Clinic at Easter Seals. Jason is on the line, and Kim Kalari is unfortunately on vacation. No, fortunately for her, with Baltimore Station. And basically, I think this really did start about 4 years ago when Cynthia Macri, Cynthia Cavallari, and I attended a summit put on by Aberdeen Proving Grounds dealing with opioid abuse. And based upon that, Dr. Macri, excuse me, asked if we could be part of a subcommittee working with the Maryland Commission to talk about opioid abuse impacting Maryland's veterans and their families. And we worked on that for about 1.5 years. It gave a final report. And we are fortunate enough to be able to meet with the Opioid Operation Command Center about some of the issues we found. And fortunately for us, they took a lot of the things we said and moved forward. So what we're going to talk about, and we're hoping we'll get more dialogue, and I apologize if I seem to monopolize. I really don't want to do this. I just think this is a very important subject. So you go to the next slide. When we started our current work group, we put together a vision/mission statement. And the 4 areas we talked about was marketing to increase the availability of service for Maryland service members and veterans to address substance misuse, abuse, and diversion. We wanted to identify service providers. We wanted to propose strategies to increase the number of qualified counselors, because everything we heard, and it hasn't changed, there are not enough qualified counselors, drug and/or mental health, to deal with the surge that COVID caused with regards to substance misuse. And we're also going to talk about developing metrics to capture data. And I'm going to ask Cynthia to do that. And there's one of our other members, Rick Lane. How are you, Rick?
I'm doing fine.
Good. So let's go to the next slide. So recovery and treatment programs. We met with several recovery and treatment programs in the area. We include Stephen A. Cohen Foundation, the new Headstrong is part of it. We also met and went to Turk House. Besides that, we also went to the 3 VA medical centers, and we'll talk a little bit more about that. And we also provided information to the Maryland Department of Veterans Affairs at their quarterly meeting of the Maryland Veterans Commission to inform them of what our findings were, and we'll go back into that. At the same time, we were fortunate enough to be able to contact the Maryland Military Installation Council, which represents all of the military installations, and we were fortunate enough to get Headstrong to be a part of the discussion. So marketing is two ways. We were marketing to the recovery and treatment centers about programs that are available for veterans and their families. And conversely, we were trying to get them to connect with Department of Veterans Affairs, since we have 3 different VA medical centers. Next. So we identified the providers as the U.S. Department of Veterans Affairs. We've contacted and talked to the Substance Abuse Mental Health Services Administration. We currently have been talking to the Maryland Opioid Operations Command Center, and we had a meeting with the Maryland Department of Health Behavioral Health Administration. From the nonprofit side, I've already mentioned that we are talking to Headstrong. We have Stephen A. Cohen, who is part of our work group, and that brings the counseling aspect that a lot of the individual recovery and treatment centers did not know at the time. And the VA was not necessarily, I'm not saying they weren't aware of it, but they didn't realize how far the Cohen Center reached. And conversely, to be honest with you, a lot of their staff didn't know about serving together. So again, it wasn't just us receiving information, it was also informing them of opportunity to help their veterans who were enrolled in the programs. And of course, I put Maryland Center for Veterans Training because I volunteer for them, and they also help individual veterans who have become homeless. And a lot of times it's because of substance misuse. Next. So we propose strategies to increase counseling, because that's one thing that Dr. Macri kept telling us, that there weren't enough people. Even if we were to be successful in market, it might take a long time for an individual to receive counseling. Again, I saw 60 Minutes, and they said for some people, it's almost 40 days to get into a counselor. So we met with a group called Solid Design, and basically what they do is their part working with the Department of Defense. They do what they call credentialing opportunities online, and they allow individuals who were in the military to transition and get certified in occupation and civilian sector. So we'll talk a little bit more later about the occupations such as being a corpsman, a medic, or a psych tech, and how that will fit in. We also want to talk to colleges and universities. This is a discussion we're having right now to hopefully hold a summit and talk to the college and universities about reducing the time to get certified to be a mental health / drug counselor. And conversely, if you're going to talk about certifications, Maryland Department of Licensing and Certification provides that opportunity for individuals to reduce the time to be certified. So we already talked about the transitioning military personnel, and we realize we have a minimum of 10 military installations. And we do literally have hundreds of corpsmen and medics and psych techs who are going to get out of the military. And if we can help transition them to the occupation of mental health / drug counseling, we're going to be at least have a partial answer to some of the concerns we have. And lastly, we also are dealing with Headstrong, which we think is a great opportunity. And I have to thank Serving Together for the introduction, especially Jason, who introduced us to Headstrong, and realized that they just come into the Baltimore area since January. And their concept has been, they're not for profit. Hopefully people have heard about Headstrong. If not, you please look it up, and you'll see that they're also the more we talk about substance misuse, the more chance we have of referring people to the right resource. Next. So I'm going to let Cynthia talk about capturing data to monitor awareness, because I know you're bored of my voice.
Thanks, Dan. So part of this conversation with this fourth focus area is, how do we show that these efforts are actually contributing to awareness and effectively contributing to referrals and making making sure that we're meeting those 3 previous focus areas. So can we take what we're doing from one-on-one, transactional, one-time information sharing to a place where it's more strategic or more operational, where the information is not only being made available to people who know how to ask for help and where or who to ask for help, but it's accessible by those outside of our immediate or known context, right? Not the Kevin Costner Field of Dreams thing, right? Where if you build it, they will come. You know, there's actual work that's involved in making sure that it gets out there. So if we're able to communicate this information to points of intake or to incorporate it as part of your respective referral processes and staff training, where this becomes part of the Rolodex, part of your SOPs, part of your checklist or the database of available resources. And if so, are we able to quantify the referrals or qualify the potential reach of that, right? So would it be feasible or effective to distribute informations to the service members, veterans, and family members in your communities and have a reporting mechanism with predetermined data points or info, again, data points to talk to each other from across the various systems, while we still keep the administrative burden low, but the data meaningful, impactful, and worthwhile. So can we leverage our respective communication methods, whether it's newsletters, social media, emails, text, website, right? All of these digital marketing platforms come with built-in analytic tools that monitor the activity and the performance of who's being reached and how are they being reached. So not so much to say, add it to your newsletter, add these resources to your website. Some of that is knowing how to update a website. And then more practically, how do we get that feedback from the different veterans advisory councils at the county and city levels? How do we get that information from VSOs or, Maryland's Commitment to Veterans, Maryland Department of Veterans Affairs? How do we do that in a structured, standard way that does not add more work, but can still reflect the value to everybody involved? Next
Thank
slide.
you.
Back to you, Stan. Yeah.
Thank you. You did a great job. Before I get to the next slide, I do want to say Wayne's on the line. So I forgot to mention the Vet Center program as being an integral part of counseling. So I did mention it, Wayne. You can pay me my 50
I had to
cents
step out.
later.
Sorry about that. Thank you.
I'll get my 50 cents later from you.
All right, I thought you gave me a discount. I thought it was $1, but I'll give you 50 cents.
Well, the penny for your thoughts has increased with inflation.
Okay.
So one of the things we really, again, a lot of these findings and recommendations were based upon our talking with the Department of Veterans Affairs, their substance misuse, talking to recovery and treatment programs, and getting information. We did a survey to some of the Serving Together providers of recovery and treatment. One of the things we found, again, was capturing veteran status is not necessarily happening at some of the recovery and treatment centers. They don't ask the question, did you serve in the armed forces or the uniformed service of the United States military? They don't ask that question. So we're hoping that we brought that attention forward to the Maryland Department of Health and Behavioral Services Administration. Hopefully that's going to change because we do want to find out more. Conversely, we don't know if hospitals and or first responders ask that question. There's a campaign, ask the question. I think that's important for all of us to ask the question, did you serve in the armed forces? We also were finding out sometimes veterans were not aware. So the VA and other service providers had veterans in their programs, but many of them were not aware of the benefits or outside programs that those veterans and their families could take advantage of. So for example, we asked sometimes some of the recovery and treatment, do you work with the VA? And they gave us a quizzical look. We think they should, and that has changed somewhat in the last few months, but nonetheless, there's still a discussion we need to have. And conversely, when we talked to the VA medical centers, we found that some of the staff weren't aware of the Stephen A. Cohen, weren't aware of the Serving Together, weren't aware of the Maryland Department of Veterans Affairs, their benefits officers. And the reality is that sometimes some of these veterans and or their families would be eligible for some of these benefits. So we were not giving them everything we needed to. And one of the areas also told us that transportation was an issue, that they could send people and appointments for counseling, but nonetheless, if they didn't have the funding to pay for the transportation, that was a challenge. And they a lot of times depended upon volunteers. A lot of individuals believe that veterans automatically are eligible to receive a reimbursement, but that's not true. And yet at the same time, some of these individuals didn't know about some of the transportation that was available. Another thing we found out, and we actually did get some data, that some of the veterans may have had to wait several weeks before they could get into a program. So if I'm veteran A and I call up the VA, the first thing they're going to ask me is, are you enrolled in our healthcare program? And if they're not, they need to get enrolled. Then once they're enrolled, they'll have to meet with a individual to talk about, are they eligible for the program? And then you have to determine, okay, when is the availability for them to meet their first appointment? Again, we do have data we got from a senator's office, which shows that it was taking some places up to several weeks to get an individual enrolled into a program. So that's an issue that we need to address. Like I talked about, many veterans did not use the VA system. Only about 40%, and Maryland is one of the better states. So think about that. 60% of the veterans are not using the VA system. Conversely, we talked to individuals from the VA who said when one of their studies showed that 7 out of the 11 suicides of veterans, not one of them touched the VA system. So we need to do a better job of marketing the program, marketing what the VA does and what the recovery and treatment programs do. The other thing we also found out, like I told you, there's a disconnect between the VA and some of the recovery and treatment programs. That is somewhat being addressed right now through the VA community engagement and partnership coordinators, but like everything else, more needs to be done. So before I go on, I wanted to know if there's any questions at this juncture, or if I explained everything so well that nobody, it's sort of like when I send my notes to my meetings, nobody responds back to tell me I did a bad job, which is okay. That means I must be perfect.
I got a question.
Oh,
This is
okay.
Wayne.
I'm
So-
listening.
One of the things I'm looking at your synopsis here. When it comes to transportation, when it says the barriers are there, I mean, there are, I guess part of the barriers are there is also the marketing of what is available too. Is that when I look at this marketing, it really encompasses a lot of what you're saying here. We're just not we're not getting the word out across the different markets as you got here, or the different communities or sectors within the community for the different healthcare or health services within the community. Is that what you're kind of stating out here?
Yeah, that is absolutely correct.
Because what I agree. I mean, I see there's different programs. I think we hit these meetings and you'll have organizations say, yeah, we do that, but then they don't, how well is that being marketed beyond our collaboratives and things of that nature as well?
Yeah, so when we talk to the commission, Maryland Veterans Commission, we have 29 members and each one represents a major organization, DAV, PVA, whatever. And then you hope, because we don't know, we hope they are bringing the message back to their members.
Yeah.
But in reality, probably some are, some aren't.
I agree.
A couple of things we also, when we met with the Department of Health and Behavioral Services, which we want to thank, we already thanked the secretary for arranging that meeting. We had a chance to talk with several of the people. And we wanted to request that there be a joint summit of a variety of players. And currently we do have an idea of what a summit would include, which it means one section would be dealing with finding and working with the public safety, hospitals, and law enforcement to ask the question and then refer them to the appropriate, now I guess it'll be 988. Second thing we talked about was getting the colleges, universities, and DLLR, Department of Labor and Licensure, to work together to reduce the time to become a certified counselor and or mental health. And with the amount of people getting out of the military who are corpsmen, medics, and psych techs, plus the training they received in the military, we think there could be an advantage. We just need to, and conversely, some of the recovery and treatment places could probably use some of these corpsmen medics to do some of their, what I'll call case management. They don't necessarily have to do the quote unquote counseling, but they can be the case managers while they're getting their certification. Again, that's a discussion we would like to see in the summit down the road. We also asked again that we identify whether a person has been in the military. So increasing the VA enrollment and marketing is important, but we also have to make sure that the VA is ready to accept these individuals. It's one thing to say, go to the VA, but if the VA doesn't have sufficient resources to take care of it, then what are we going to do next? So I think that's the other thing we were talking about, is putting together a group of professionals to talk about what are the next steps? What are some of the answers? Headstrong is a partial answer, but it's not the only answer. There's got to be other answers to refer people who need that assistance right away. So what we're looking for, next slide.
I think I saw Danny come off mute. Did you have a question, Danny?
Well, I mean, I guess it's almost rhetorical, right? I mean, I feel like oftentimes there's barriers of entries here for a lot of veterans to access these programs. It could be the providers, it could be the VA application process. And so I guess to get these services rapidly, I mean, it happens in my side of the business all the time, right? Sometimes we get them, it's too late. And by the time we can even start services, the veteran is passed, right? But is there a process in place? Is there a way that the VA is trying to expedite the onboarding process for this, for veterans that are in highest risk? Is there an easier, and again, I think I know the answer to it, as there's not really, but is there like a shortcut? Is there a way that we can advocate for sort of a shortcut for some of these veterans that are at higher risk? Some of them, you know, if you're trying to get a homeless individual off the street, you know, to literally get them off the street that day, right? Or is it still the same process? I mean, you have to submit an application, wait for a response, which could take a week to 2 weeks. Then you have to talk to another individual, and then it's availability. And it's the same thing, it seems like, with almost every service out there. But, you know, is there anything in the works to help expedite this and actually impact change? I mean, we could try to be as efficient as we want here, but if the VA doesn't make it easier.
Well, again, I don't want to make it a VA thing. I really would like to make it a treatment, recovery and treatment, including the VA. How do we make it easier for individuals? And that was the purpose that we were trying to do a summit, to bring these players together and talk about what Headstrong is doing. At the same time, is there other ways of having the Stephen A. Cohen Military and Family Clinic get involved to provide maybe the counseling in the very beginning and then referring them to is there a way to do that? I don't know. That's not my business per se, and I don't mean that negatively. I just know that there are steps that can be taken, but there are going to be a lot smarter people than me. That's why I have a committee of smart people, because they know what to do.
All right. Well, that's good. I mean, I'm interested in the summit then, and I'm assuming that the VA is going to have some decision makers at this summit.
If we get the summit, you're absolutely correct. That's always the what ifs. The what ifs. I'd love to see a summit. We proposed it, but I can't promise you that it's going to happen. All I can tell you is that some of us are working hard at seeing if there could possibly be a summit.
Well, and let me pose this to the group as a whole. I mean, this is a group of individuals that have a tremendous amount of knowledge in general, but like, is there an opportunity for us outside of, and again, in the CVEB meetings, we don't really have an opportunity to chat. Is there an opportunity for us to advocate for some actual change, some, to the VA directly? Because honestly, this all starts at the VA level, right? They have to open it up for us to be able to make this happen. I think there's really no shortage of individuals out there that want to support and help veterans. It's just getting them approved through the system that I think is the biggest barrier of entry.
Well, Wayne, do you have anything to say? Because you're with the Vet Center program. And we
Right,
keep
so
on-
so here's the thing with the vet centers too, is one, they don't have to be enrolled in the VA to come here. So that would be a shortcut to get, like you were saying, Dan, to get them in the system and get them going while they're going through the process of eligibility. Eligibility is not that long. It's once you're through eligibility, it's the next step of getting care. That can take time, but in the meantime, they can come to our centers and get that care is when they need that eligibility that we have. Unfortunately, the vet centers are put in a box by Congress, really. But our box is being spread, which is a good thing. That all being said, if a vet comes in here with maybe a drug and alcohol issue, but really that stems from PTSD, that's really where we would receive them in, right? So then what we would do at that point is help them and navigate the process of eligibility. And then from there, if they need long-term care, they need to go to either Martinsburg, which is where the inpatient program is, or Perry Point, got one of those places, we would help navigate that. Now, again, those portions can go pretty quickly but they got to be in the system overall. And I like what Stan's saying, it's an overall treatment. Sometimes it might be faster to get them outside into a non-profit organization. Could be an outpatient, could be an inpatient program. But I think you're right. It is a matter of collaborating together in a substantial way. And that's where it comes with case management. So I know all of us are trying to do it, but that I would say for within the VA system, the best part is to come to the vet center, because we're not required to have eligibility. It's not a requirement for a veteran to be seen here to be enrolled at the medical center.
Sure, and you know what? And Wayne, I mean, I love the vet center. We're going to eventually be working out of a vet center as well. I mean, I love that premise, but even the vet center itself, like you said, is put in a box and is limited by its ability to do things, right? And so it'd be one thing if I had some sort of veteran that you're trying to get certain resources for, but if I was to bring in a homeless veteran to a vet center,
right,
and that veteran is homeless that day, is that veteran going to leave the vet center and have a place to stay?
I can't tell you every single time.
Right, and that's my point, right? And there's not
and
that's it.
I don't think there's any organization that can really do that, but maybe so. And I may be missing the boat too. But what I think is we always strive to have a place for them. It could be a shelter. Unfortunately, that's really because when you're coming in a last minute scenario, everything takes time. So what happens is, as you know, we're going to come in, a vet's going to come in that scenario. We're going to more than likely get them coordinated with a shelter. Unfortunately, that's not the best deal, but to get them in a program, I don't think, in my experience, has happened overnight. Usually it takes a few days, if you stated, so you've actually made that statement, and it's true. I don't know of a program that can bring them in. They walk in the door in the VA, unless they actually walk into the hospital drunk or down in, or I don't know what the requirement is, unless they actually walk into Perry Point or Martinsburg that day. Now, I don't even know if they could do it. If they had to have openings.
They have you're right, they have an emergency
Yeah.
way of getting them into the system. But that's not going to happen to a lot of veterans
It's
and
not.
or their family members if a person is just misusing
Yeah.
and they
And,
call
and
up.
again, I think they're all band-aids, y'all. I'm sorry to interrupt
that's
again.
okay.
I mean,
Yeah.
I feel like these are band-aids to bullet wounds, and what ends up happening is there's almost always a fall off and follow up and follow through. And it's not, again, to any individual organization's fault, because there's a high demand for this, and there's very few people that end up doing this, right? Everybody's overworked and understaffed. So, but something at some point has to change if we want that to. I mean, Stan's statistic is what he had read out: 7 out of 11 have never touched the VA system of suicides, and there's that. Like, how could that even? That's absurd.
Yeah,
it's absurd.
Well, again, it may be absurd, and it means that we have a long way to go to create bridges, and that's what we're saying, bridging the gaps. And that's what we're talking about today.
Yeah.
That, again, I never promoted the vet center, which is my fault because I didn't think about it. So I have to always be reminded of what the vet center really does, so we can refer individuals to them who need immediate assistance. Conversely, we also need to make people who are in the recovery and treatment programs aware of what it means to be a veteran. A lot of them have no clue.
Sure.
And that's the educational part of it.
Hey, Stan, Dennis has been extremely patient with his hand up, but I know we had one more slide after this, but just Dennis has been so patient with his hand up.
Are you there? You hear
We
me?
can hear you, Dennis.
Okay. Two things. The first thing is you're talking about, marketing. How involved are you in reaching out to reserve units, guard units through the FRO, the Family Readiness Officer? I know my unit actually had a FRO there for the longest time, and actually right before I retired, they actually got rid of that person and kind of put it onto the first sergeant. So they're kind of actually, so I know at least my reserve unit was actually cutting that umbilical out. So that's my first question is, are we reaching out to these reserves and guard units?
And my answer is, I don't know.
And Dennis, I know I have one. I just retired from the National Guard here in Maryland, and I was a chaplain, so I promoted a lot, the community as well as the VA. But you're right. There is a lack of promoting. I know the vet center, we do promote to the guard and reserve communities all over Maryland with each vet center, not just mine. We all do it. Example, I know Steve Fife is going to be with the 175 in a couple weeks. I'm going to be with the 58 this weekend. I know I'm going to be with a med debt in June. I'm just, again, you're right. And that is a key asset. And that's where the vet center program has opened the door to the National Guard and Reserve components. That just happened. It's almost like they got better access than anybody else right now, to be honest.
And at the same time, Dennis, when we were I'll give Cynthia Cavallari her due. She pushed that an individual from Headstrong do a presentation for the Maryland Military Installation Council, which includes the National Guard. So that was brought to their attention that there are issues. But you can't just do it one time and that's the end of it. That's the issue right there. It has to be a continuous discussion.
Absolutely. And I know most, at least my reserve unit, they had a family day every day where they actually bring on resources, things of that nature. But like I said, it's at least when I left, they were rolling that back, that umbilical, that. So maybe reapplying that pressure might be a good way to go out there and increase marketing. And my other, you go ahead.
Okay.
I was going to say my other comment is that, I've noticed a lot of these programs, they're focused on vets with the most need. And I'm going to tell you from some personal experience I was struggling for a while for back in the past, but I had a job, I had a house, and I was asking for help and it wasn't there. No one wanted to help me because I wasn't in that need group. And when you get to that point when you're asking for help and no one's asking you as you're falling, you're not going to ask for help when you hit the bottom. So just want
So
to put
maybe,
that out there.
so maybe we're missing an element that we don't have, which is called going out to the employer community and talking about some of these issues. But at the same time, you got to be careful.
I think it's more of that, understanding that it might be easier to catch the people as they're falling instead of waiting for them to be on top.
Or catch them before they fall, Dennis. If everybody's aware and knows that these things are available and those resources there, and we're able to share this information without the stigmas and letting people know that it's totally okay to ask for help and you should be. I think one of the biggest advocates for right now is the SEAC, the Senior Enlisted Advisor to the Chairman of the Joint Chief of Staff. He is out there and telling folks, I have sought help, I need help, we all need help every now and again. And so I think it's that whole, why this Venn diagram here has so many overlaps, right? Because that's just that you can't do one without the others. But Dennis's point, Stan, goes straight as a great segue to the next slide. So we can hear from everybody else too. So thanks, Dennis.
Weren't we just doing a group discussion?
Yeah, well, that's just it. We jumped right into it. So next one, Christy, please.
Yeah, actually, I got one more thing just on a segue to the previous thing that I mentioned, that the lowest point I think for me was when I applied for a federal position and they rescinded it 3 months after I got it because they did not want to wait for my security clearance to be reevaluated. And I asked for help, and I just remember it just wasn't there at all. And even before that, when I was like struggling with housing payments, it just wasn't there. I actually had to reach out to my congressman. So I'm just saying, like, they struggle, and it's like, and I just remember just pounding on the door, just asking and begging, pleading for help, and like I said, this is like 2010 timeframe. So.
Hey, Dennis, this is Wayne Stetchcombe. I hear you, and I tell you what I did know. I've noticed there is a gap, and again, this gap is the gap of you're not rock bottom. You do have a house, but you're in this middle quandary. Either you lost a job, you're transitioning to a job, things of that nature, where something happened, and now you're in a quandary. But before, like, all your documents show you make good money, all your tax documents, you make decent money the year before, or you do your budget and it looks pretty good, you should be okay. And so what happens is that a lot of these organizations they would say, well, you're doing okay. And I would agree with you. I've seen that. And I guess, Cynthia, you were pointing out that's really where that is a major gap, is where do we get them before they get there, right? I mean, awareness is going to be key, but it's not just awareness. It's going to be organizations that can say that they can push their envelopes a little bit, because they put these nonprofits and other organizations they put a box in themselves and what they can do based off of their bylaws and things of that nature. And so then they can't go out of their box because of their grant money or whatever reason. They get stuck in their box. And I've seen where every now it's rare, it'll happen. It can happen, but most of them stay in their box. And but that's I would agree with you. That is an issue, big issue.
Well, again, looking at possibly talking to the veteran service, or I'm not saying that's an answer, that's just a partial answer. Going to the veteran service organizations to have them have this discussion. It was like, I'll say it to you, a couple of years ago, a gentleman, a colonel, was very upset that he had no help with his military installation with regards to people having stress issues. He needed more counselors. And when I mentioned that there was an organization, I won't say who it was, that could possibly help, the first thing that individual said was, well, how will we know if they go there? And I'm going, you shouldn't know. It's an educational factor too. So what are we missing at this point in time? What didn't we cover that you think is important? Anything about, again, Wayne, I appreciate it. I'll make sure to talk to the person who really does the hard work, Cynthia, about putting in the vet center program,
Well,
because that is crucial.
I can tell you what I do. I'm an outreach guy, and what we do is we go all over the community wherever we can and get open. So I think one of the things we can do is collaborate together. When any organization here is having an event or know of an event that one of these organizations that are on here or others that would be a good fit for that outreach, that activity, maybe spread the word so that not just one person is, or, that way we can, that's marketing, right? So the collaboration of marketing, it can be something that we do. I know at the end of the day, it's about helping vets and service members and their families. So that's what we got to think about. And I think if we did something of that nature, that's, again, like I go out, I have at least 2 or 3 or 4 other organizations information on my table. It's things that I like, that I think that I know of, and I think vets will like, depending on the event. So they'll switch around. So that's one thing. So maybe we all have some literature from each organization that we can share as well. I know in my lobby, there's stuff like that. Now, I think that's part of the missing plan program when it comes to getting the word out and the marketing, because that'll help all these different aspects that we were talking about. And that's the part where I think right now.
And as you just said, when there's an event, maybe we can invite not just the VA, but other recovery and treatment centers
Exactly.
to be part of that event. So that's a good next, what are the next steps?
Yeah, again, Wayne, I think that goes to the whole, I have to know who to ask for the thing specifically to know what to do next, and yeah, absolutely. And for instance, like the very last slide has a couple of the organizations that we talked about. And even then, thankfully, Christy's recording this and she'll share the recording. So if folks weren't able to join, they'll see those links. But then so what?
Yep.
Then what? Now what? What are we doing with this information? And again, is there a feasible way that we can track that information and go, this is potentially how many people we reach with this? Whether it's unique identifiers, whether it's using everybody's websites, marketing, Wayne, you go out and do an outreach event and Wayne can say this many people stop by my table, but it's not extremely burdensome for you to say 50 to 100 people were at this event and they were exposed to this, and it's just us doing that on.
I have to do that I have to do that. I report that every event I go to for the VA. I have to do, that's exactly what I do.
Yeah, and that's exactly what all of us do all the time, right? We have our own reporting mechanisms, but do your data points talk to our data points that talk to Serving Together's data point? You know what I mean? Like,
yeah.
Sorry. And Dennis, I'm sorry, you are the most patient man.
That's all right. So just going back to that one slide about what's missing, and I just want to share a story. I read this like 5 years ago. There was a Marine Reserve Infantry unit that deployed to Afghanistan. They had the most casualties of any other unit. They came back, and a year later, they had a string of suicides. Yeah. And while the story was talking about is they were like, we caught up with Sergeant so-and-so. He's right now working at a kiosk stand in the mall. And they go on, blah, blah. Now we caught up with Corporal so-and-so. He's the janitor at the local middle school. And it keeps going on. And it goes on and on like that. Then at the end, they're like, and no one knows for sure what's going on. And I'm sitting there like yelling at the screen while I'm shaking the monitor and screaming at it, going, I know exactly what's wrong. And it really has to do with is these individuals went out and they had such great responsibilities and they had such, they put a lot of effort into their work and they had all this stuff. And then they come back and everyone's like, great job. All right, here's a job. We got you a job. Here's a mop and bucket. Or here, you're going to sell hats down at the mall. So it's really about giving them purpose. Yep. Which is the best way to do that is through employment, but it has to be good. It can't be any kind of employment. It has to be good employment, meaningful employment.
Yeah, and that definition is going to vary by individual, right? To find that right job fit, that right organization fit. But I think that's where kind of like the summit that Stan was talking about, or these conversations where it's not just collaboration for the sake of using the, $10 word. It's actually working together, action-oriented steps for these stakeholders from the public sector, from the private sector, and going, not one single organization, like Wayne was saying, not one is going to be able to fill all these needs. But if there's a way that we can set this up for all of us to come together and do this in a truly collaborative way to alleviate those challenges, not just this one time, not just for that one veteran, not just for that one spouse, but sustainably, how do we do it? And so I know that a lot of your organizations do a lot of that. And like Wayne said, some of this work you're already doing, you're already tracking. So what makes sense to not reinvent the wheel, but to leverage some of those leading practices that we're already working on? I'm looking at, our two representatives here from Serving Together, and all of the great, what they do is not just lofty, in a perfect world ideals, they're practically doing this work.
So a quick question, do we have any champions on Capitol Hill? Because my honest opinion that, when it comes to, finding meaningful employment can be enacted through congressional action, legislative action. Because right now we're just depending on private businesses to, do the right thing without any incentive. I could tell you, if I was a small business person, I would not want to hire a reservist thinking that they might be leaving in 9 months or so. So
Again, you're right. But at the same time, I don't know what happened to the National Guard. They used to have an employer supported the Guard and Reserve, where they would go out to the employer community and talk to them about a lot of their appreciation for what occurred. As far as employment, we have Tom Fort, who is newly appointed. He's going out to employers to talk to them about hiring. There are a variety of programs, both finding federal employment. People forget about state and county employment, but you got to be prepared for it. And that's the hard part for a lot of our fellow veterans. I was 11 Bravo, so I can tell you I came out, and we're not even going to talk about what happened when I came out, other than I was fortunate enough to have a dad who kicked me in the butt and said, get to college first. That's what he did. But I was lucky. A lot of my fellow peers were not as lucky. Tom, I turn it over to you.
Hey, Dennis, just to play off a little bit what Stan was saying, I can tell you at the Maryland Department of Labor Veterans Program, we are focused on finding vets careers, gainful employment, not just gap filler jobs. Now, in some cases, we may feed them into a gap filler, based on their immediate needs, but ultimately we're there and we're out talking to businesses about the value of hiring veterans, and we're very focused on, meaningful jobs, meaningful careers for these veterans, not just, working on a
Absolutely.
kiosk at the mall. So.
yeah, absolutely. And look at my video's working again. So hi everybody. But so I can tell you from my experience, I was a gunnery sergeant at a Marine Reserve unit, and I've actually had to call up managers of my Marines and tell them, no, you have to let them go to drill, and no, you cannot make them take vacation time.
Right.
And I've had to actually write letters and give them, I think that's called USARA, right?
Yep.
But and I've actually had people got fired shortly after that because they're like, oh, they were late for 5 minutes one day, so I have a right to fire them now. So
No,
USARA does provide some protections, but I found that they can be easily gone around. So
well, again, I used to investigate USARA claims. So yes, you can find 1,000 ways to turn, but again, I also had to investigate them. And I would tell you a lot of times it didn't work the way the employer thought it would work.
Yeah.
But we don't want to go into that. What we want to do is try to work with individuals who are willing to serve in the military and find them a career at the end of the rainbow. Mm-hmm. And so we have people here from the Stephen A. Cohen. Mallory's here. She can talk to you about the Veteran Staffing Network, which again, I think is an ideal program because it's a temp to perm job. A lot of times individuals aren't ready for a full-time job. But we're going away from the subject, which is substance misuse. So again, I'll ask, were you able to show that last slide with all
Yeah, real
the,
quick. Yep.
and we'll share that with people anyway. So those are the different resources that are currently available.
And just to kind of a couple of things that came to mind, in terms of serving together and the work that we're doing, in terms of some of the conversation that you guys have been talking about. I would say, some of the research that we've done or been part of over the past 10 years since we've been operating has really talked about how there's typically like an 80-20. There's about 80% of veterans that are probably doing fairly well in this region. They have probably meaningful or gainful employment. They have, maybe family or social networks and things set up for them. But I think Dennis provided a great example of himself, right? Like, he may have been gainfully employed and doing well, but he may have been struggling with other needs, right? But he couldn't find an answer to that. While there's the 20% that are really struggling, that, are reaching out to various supports and getting connected to a lot of various needs. And we've talked about how we reach that 80%, those individuals that may be doing fairly well, but maybe they have one or two needs that they're trying to address. And I even think about when we talk about ways to reach the veteran community and individuals that may not even associate themselves as being a veteran, or, consider themselves with that veteran status, even when we think about National Guard and reservists, sometimes they don't even get qualified from the VA as being a veteran because of the way that the federal language is when it comes to being that veteran status. So a couple of things that we're trying to do in terms of marketing, obviously, is making sure that we clarify if someone is have they served in the armed forces, and making sure that we clarify that when we're talking to them, but also looking at non-traditional ways to reach that community. Because I think of someone that is my father's age, who right now he's mostly a homebody, kind of stays at home majority of the time, doesn't do much technology, maybe a little bit here and there. His biggest places that he goes to are the grocery store, the pharmacy, and maybe his medical appointments, right? So how do we reach those veterans that aren't, using a lot of technology? Maybe they're not going out and about to resource fairs and events and activities, right? And look at different kind of non-traditional ways to reach the populations that maybe are harder to get to, and beginning to tailor our marketing campaigns, our social media advertising, our communications out in the region, to hit some of those audiences or individuals that may be harder to get to. And so that's some of the things that we're looking at on our end, incorporating into the plan, and being able to reach out to spread awareness about serving together, which ultimately is the network as a whole, the Unite DMV, Unite Maryland network that we're operating and helping to support the connections with all of these organizations. But I think that there's still so much work that can be done, especially when we look at our end in terms of connection to the VA. Being able to streamline referrals to the VA more seamlessly is something that we still struggle with, and we could find support and opportunity from the players in this group and in this committee to help us with. And I think that that's a great solution or a great opportunity, to really band those people together, because that's our goal, is to collaborate. And that's what the mission of serving together is, to collaborate with all of you guys to get those veterans connected to the right place as seamlessly as possible. And so all the things that you guys have talked about today are things that we want to support, help, and collaborate on to make it more successful. Hope you're on mute, Stan.
Well, a lot of people like it that way. But besides that, I would be remiss if I didn't thank the whole work group. And I got to give a special shout out to my friend Cynthia Cavallari for helping put together this PowerPoint presentation. We hope you will provide us with feedback. If you think we need to do something else, that's okay. We are interested. And I want to especially express my appreciation to you, Christy, for allowing us to talk about some of the issues that are impacting not just us, but our veterans and service members and their families throughout Maryland. And we're keeping our fingers crossed that we're going to end up with a summit. We're going to keep going because they don't know that I am the chief of PETA, because I won't stop until we get done. Or Lane, anything
Yeah.
you want to add?
I would. Can you hear me?
Yes.
Okay. I would like to add, I think that this is a great first start. One of the things, I'm just sitting here listening, one of the things that I see that everyone brings such a volume to the table. I don't know half of all these things that are there and how to navigate a lot of these programs that are here with us today. So there's a disconnect, and that summit stand would be a huge beginning for me to understand what it is that, just for the sake of discussion, just what Headstrong is doing versus Maryland Department of Veterans Affairs is serving together and all of that. There's also little nuances that happens that could enhance programs. One of the things that you brought up, Stan, I thought is very important that Mallory had just discussed, which was going to the grocery store. A little simple thing like going to the grocery store, there's a tag on the shopping cart that says, for veterans, if you need help or information, pull that card and make that call. That's just one little small thing that'll help that veteran that's not that tech savvy, such as myself, to get services. The summit would be a great start to start putting these things together, these little nuances together, where I can reach out to Mallory or to Wayne or to whoever and to say, what can you do to help me that I can disseminate to my group? And I'm from an area, Baltimore City. Whew, man, you talk battle. I need 11 Bravo just to handle that area. So you guys understand the uphill battle. We also talk to our first responders in Baltimore City. They don't even ask the question, have you ever served? So we have officers and firefighters and medics going out to places, domestic disturbances and places like that. They aren't even asking the question, have you served in the military? Because a lot of our veterans don't understand that. They think that they aren't veterans because they didn't go to a war zone or they weren't in for, they didn't retire or whatever. So it's a Herculean effort for us out there. I'm in for the long haul, like Stan, like the rest of us. But I certainly like to get to know folks better so I can disseminate what programs you have that I could push into the communities in my little bailiwick. And thank you for hearing me and allowing me to ramble on.
That's okay. They allowed me to ramble on, and I appreciate it.
Thanks, Matt.
You're sharing wisdom.
Awesome. Well, thank you so much to Stan and the rest of the team for attending today. I thought this was a great discussion and definitely has opportunities for next steps and lots more to come. I know that we're kind of at the hour mark, a little over the hour mark, and I still want to give you guys the opportunity to network, share any updates or events and things like that you have going on. So feel free if you need to drop off, you can, but I think this is a great time for the next, 10, 15, 20 minutes, how long we want to go, to really share if there's any updates, news from your organizations. And then I would love to hear if there are next steps or future topics that you would like to hear at the next Central Maryland Veterans Collaborative meeting, which will be August 9th. So mark your calendars for that. And yeah, I'll kind of open it up to you guys to see what updates, announcements, or feedback you'd like to have on future meetings.
Well, I'm going to bring out one thing. I just received a notification. I've been invited to the Maryland Durable Medical Equipment Center. I don't know if people are aware of it, but the Department of Aging has equipment available, medical equipment for the elderly. Anybody, you don't have to be elderly to have it. So I'm going to do the tour. It's June 15th, but I'm making you guys, or everybody aware of it. You should look under Department of Aging and look at the durable medical equipment, because somebody may need a wheelchair, somebody may need a crutch, somebody may need a cane. And that doesn't cost anything. It's free of charge.
This is Wayne Stinchcomb with the Silver Spring Vet Center. I just want to let everybody know, one, thank you for this. I thought this was we're heading in a strategic, we're talking about strategic planning here, and I like that, to do some good things. So first, I wanted to make that statement. But I do want to let you aware, next, the 19th, doing a little lunch and learn around 1 o'clock. We're going to have a discussion on OCD. One of our counselors will be doing that. That's usually about an hour pre-stage. It's virtual. I'll get out a flyer, and then you can join up into the meeting if you'd like, and distribute as well. But this is one of the ways we're trying to get words out about different topics as well on behavioral health topics, is having these monthly or bi-monthly lunch and learns. So I'll be sending that out.
Wayne, do y'all have a calendar, or is it like the same recurrence, like third Thursday at 12, something
We
like that?
try to make it that, but I know we've had some hiccups. Just things happen. And so like last month, we didn't have one, but it is typically the third Thursday of the month at 1 o'clock. Let me make sure. Yeah, 1 o'clock to 1:30 to 2:30 at the latest, but we do say for an hour and a half. We provide an hour and a half. It's typically an hour and 10 minutes with any discussion. So right now it's been our counselor, Lauren. She's been the one doing that. And eventually we'd like to get other counselors that have to necessarily be from the vet center, but that are subject matter experts in that area. And so we're looking to continue that topic. And I like the one of, so maybe based off this topic, we ought to do good. We've had one on drug and alcohol, but I think we can have that again down in the future again. Based off this, and then we can get to spread the word. And what I'd like to maybe go with this one is more about connection, right? How do we connect? We do mention that in every topic that we talk about, but it's usually connect to us, to be honest. But what I would like to do is I like that last sheet. So I want to maybe do something like that where we can start putting some resources on the last page other than ourselves. So that would be helpful. So something like that. But yeah, sorry, that's my long-windedness.
Hey, that third Thursday was a shot in the dark, but I'm glad I nailed it. Are y'all at all like recording these? Because I know that there's a difference too, right, between people being more candid and wanting to ask questions when it's not being recorded. But if there's folks that for some reason, like they're on shift work, or they can't make the lunch and learns, like are those recorded on demand, or is it you got to be in the room?
So they are recorded, but it's on WebEx. So it's through the VA. It's on WebEx, and it is being recorded. And what I can do what I do is, if people request it from me, I'll send you the recording link. And that's the way it's been for me. I don't know. I'm still learning how to do that. So that's the way I know how to do it, where I can say, if I record it, once it's uploaded in the system, and you say, and you would email Wayne, I want the recording, and I would just I'll forward you the link to the recording. That's how I know how to do it right now. I don't know how to do it any other way. So, hey, I'm happy to be at that. I'm happy to be that far in this process.
Well, anyone that was on the Howard County one heard me give the 4 quick spiels about employment anyway. USA Jobs, there is a specific filtered tag link that'll send you straight to any of the job openings under the Bipartisan Infrastructure Law, or Bill, BIL as it's referred to. A lot of those are direct hire. So I get that not all of our veterans qualify for the veteran direct hire tracks, or some of their spouses may not. So some of those are direct hire, some of those are remote, some of those, they're all over the country or all over wherever the, USA Jobs and wherever the federal government serves. But that's an option, that's a track. The second annual Department of Labor virtual career fairs on June 24th. 9:30 a.m. to 7 p.m. Eastern. It's a virtual career fair that showcases the jobs that are available under the various components under Department of Labor. Because there's multiple sessions throughout the event, you're able to kind of cater that around what your schedule allows. So I will get these links over to Christy as well to get to everybody else. The La Petite Academy in the Federal Building in downtown Baltimore does offer childcare discounts for federal folks, which of course includes the people in uniform. So they try to keep a half federal, half civilian population for that childcare center. They are also looking to take on more children, and they can take on more children if they have more qualified, certified professionals there to hire. So if you know anybody that has those certifications or needs to refresh those certifications, there's some opportunities there. And then at the Maryland Department of Labor statewide Veterans Career Club that happens the last Thursday of every month, Darlene from Montgomery County had shared that there's 160 vacancies with the Maryland National Capital Park and Commission, and also with Montgomery County, 160 vacancies. And that the series or the occupations that she rattled off with those literally run the gamut, from highly technical to, you know, educated and experienced, to no education, to just experience, to admin stuff, you name it. 160 vacancies. That's a lot of jobs waiting for folks to fill. So those were my 4 employment related things. Thanks, Chris.
Hey, Cynthia, Department of Labor, when is that? 160 vacancies. When did she announce that?
So Darling with Montgomery County, 160 vacancies. Those have just been as part of their natural attrition rates with, as she put it, with the Great Resignation and how it's hit Montgomery County folks. The Department of Labor thing was separate, but Darlene had shared that during the Maryland Department of Labor's monthly Veterans Career Club.
Thank you.
Hey, Cynthia, just a quick question. I'm glad you brought up the direct hire. Is there anyone out there actually tracking how many direct hires are on USA Jobs, and is anyone pushing back on the government for them to stop doing that as often, so more of these jobs will take into account veteran preference?
So the way that those different direct hire authorities work vary by who's issuing it and what agency, because some of them are specific to the agencies. This one in particular, these direct hires under the bill, those are specific to the infrastructure one. So if someone centrally at OPM is tracking those and how they're tracking those and how they're sending that back, yes. Then it also depends, I think, on the veteran front, and as a veteran myself, it becomes one of those, if I'm eligible to apply, I'm applying to all of them. I don't care how you take me. I'm going to put in for all of the ones that I'm eligible for. But yes, there are folks at OPM that specifically track those, and then at each individual agency that also track those and their fill rates. And there goes Stan. There's our retired D-vet over here. What's up, Stan?
And if you're going to apply, make sure your application resembles the job announcement. Don't just send a resume that's blank to everybody, the same one. It has to be geared towards that opening. Sorry, couldn't help myself.
No, that applies to all of them. That applies to federal, state, local government, non-government, applies to all of them. Hey, Mallory, I saw your video came back on.
Yes, hello everybody. I'm trying to do multiple things at once. So I have another computer going too. So I'm sorry. I've been listening. Such great conversation. Hi everybody. I'm Mallory. I'm outreach for the Cohen Clinic at Easter Seals. I put my contact information in the chat, as well as information about what we do. Anybody in need of mental health services, all they have to do is call the clinic directly. If you have any questions about who we can serve or any collaboration opportunities, let me know. We of course have wellness programs going on all the time, yoga, Tai Chi, creative writing, but I'm really excited. I don't have a flyer yet because I'm still developing it. We are looking to do a Pride event in June. I'm looking at Thursday, June 9th from 6 to 8. We want to do a panel discussion about how do we support our brothers and sisters within the LGBT community and within the military and veteran population. Following the panel discussion, for those able to attend in person, it is going to be a hybrid event. We're going to do an art project. I'm going to help teach and walk people through painting their own pride flag. And on top of it, they can transpose whatever word they want, whether it's love, ally, veteran, whatever they want to do. They're going to have that opportunity to paint it themselves and connect with others. So more information coming out about that. But if you have any questions, again, email me. But we're looking at June 9th for that event, as well as other programs coming up as well. So happy to work with each of you and connect with you. And just thanks for everything everybody's doing. This is an amazing group, and the discussion today has just been fantastic. So thank you all.
Mallory, be sure to send me the flyer whenever you get it done. I'll be happy to share it. Awesome. Anything else? Any other updates, announcements, or feedback on future topics?
Actually, I didn't get a chance to, I don't think formally introduced at this point. So I'm representing the Goddard Space Flight Center Veterans Advisory Committee. Just so you know, a lot of the comments I made were my own personal comments. Does not reflect my organization. But I am here just to see what's out there, so I can report back to the veterans there on the center. And also, if anyone's looking for, I do know that a couple people within a couple of veterans and a couple people that work with veterans, we do have, they're willing to possibly volunteer. So if there's opportunities for them to do anything in the community, please send my way, and I can always forward it off to the other veterans at the center. Thank you.
Dennis, can you put your contact info in the chat?
Oh, okay. I will put that in there.
All right, thanks. Because I got two
Thank you.
coming your way. One, there is a group out of the Deputy Director of the Federal Executive Board out in San Francisco has put together a group specifically focusing on veteran hiring initiatives. So I think that's right up your alley based on your comments today. And then our Baltimore Young Government Leaders Group and/or the National Leadership Team out of DC will have plenty of volunteer opportunities for your folks. So ask and you shall receive.
And we have an event we're planning in the fall that Jason's leading up. That would be a great opportunity for collaboration. We're going to need plenty of volunteers for that. And then another group that I've met with recently, I'm going to mess up the acronym, but it's LIRS, so LIRS. They're supporting immigrants that are coming over from Afghanistan, but also other communities, and they're trying to help support connection, especially for those that have come from Afghanistan, with connection to other veterans. They have many that are job ready. They just need help with navigating and mentoring and things like that to find career opportunities. So they are looking to connect with a lot of veterans. So that's another opportunity I'd love to connect with you about, Dennis. Go ahead, Stan.
And I would be remiss if I didn't thank Serving Together for being part of this group, both Christy and Jason. They've done a marvelous job. Thank you, both of you.
Thank you, Stan. I appreciate it. Always a supporter, and we always appreciate you for calling us out and helping to continue the collaboration. We appreciate it. Awesome. Well, thank you all for attending today. I hope that you found this conversation beneficial. I'm looking forward to the next meeting, and yeah, have a great rest of your day. We'll see you around.
Thank you.
Take care, all.